Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Meagan Peeters Gebler, an Appleton-based physical therapist with an extensive background in pelvic health and perinatal care. Meagan holds a doctorate in physical therapy from Marquette University, is a certified strength and conditioning specialist, and has advanced certifications in pelvic health, including pregnancy and postpartum corrective exercise specialist and certified birth healing practitioner. Meagan's passion for health and wellness led her into physical therapy, and now her work is all about helping women understand their bodies, heal with compassion, and build a positive connection between mind and body. When Meagan is not helping women regain strength and confidence, Meagan enjoys triathlon training, running, gardening, and spending time with her family, including her husband, 7-year-old son, and their 2-year-old golden retriever. In our 4 episodes together, we explore numerous hot topics related to pelvic health, as well as how Meagan helps to empower women to understand and work with their bodies for lasting positive change. Let's dive into today's conversation.
Hey guys, welcome to the podcast. We are so excited to have Dr. Meagan Peeters Gebler in the studio today. Welcome, Dr. Meg.
Hi.
Hey, we're so excited
Happy
to have
to be
you
here.
Yeah, we know Dr. Meg from a couple of different things that we've done in the past. And so we're just really happy to have her here today to have this conversation about pelvic health, pelvic floor therapy, all the things. But before we get into the questions, we always like to ask kind of a fun fact and just kind of get to know you a little bit more before we start. So you gave us a fun fact that you have escaped from Alcatraz.
Right.
Seems pretty intense. Tell us about what that means.
Yeah. So that was a triathlon out in San Francisco where I got to jump off of a boat next to the island because turns out it is still illegal to swim from the island to the mainland. Got to swim across the bay and then proceed to bike and run along the coast there. And so it was chilly water.
Wasn't Alcatraz, chosen as a prison site because there's also sharks in the area there?
Yeah. Right. So my quick dive into the marine life was that they're much deeper, actually, than, we're led to believe. And then my other strategy was just don't flail around and look like the most delicious swimmer in the water.
Right. There's a lot of swimmers, so don't be that one.
Yes. Do not look like an injured seal.
Oh my God.
I feel like that would also make you swim faster.
Correct. Yes.
Did you set a record time trying to get across there?
The current also helped.
Oh yeah.
The fog did not. So.
Oh my gosh.
Yes, all the landmarks that they tell you to look for just kind of went out the window as soon as you jump in and look up and realize you're in San Francisco and there's fog. So,
and that's where you've literally become a school of fish.
Correct.
Yeah, right. You just hope everybody else is knowing where they're going, right?
Yeah, the strategy was just stay in the middle.
Yeah, no, and I just envision it would bother me because I feel like there would be like these shadows underneath me just like lurking. I would be swimming be swimming like a cartoon, like
I don't think I opened my eyes under the water.
Oh yeah.
I just didn't want to know.
I didn't want to know.
That's funny.
But that's a super cool like experience.
Yes.
And that you can say that. And then you have another fun fact which I thought was pretty interesting. So you play the accordion a little bit.
Sort of. Yes.
A little bit.
So I've taught myself a couple different songs just to have fun and play, and it's a happy instrument. And
Yeah.
just a
Okay.
few.
So
Oh,
when
that's
we have
fun.
a bonfire sometime with you, it's going to be a little bit different feel than the
There we go.
classic guitar.
Yes.
I love it.
Awesome.
Well, okay, so we are going to dive right into this topic because we have a lot to talk about in this episode and the other ones too. So let's get into it. So can you first start by explaining what pelvic physical therapy is and how it differs from traditional physical therapy? Why
Sure.
would somebody want to come to you for this kind of stuff rather than somebody else who's just traditional?
Yeah. So traditional PT tends to take a more musculoskeletal approach and often is more of a rehab for an injury. I think pelvic PT goes into different functions. So we're going to be talking about bowel and bladder function, pelvic pain, intimacy, and given the nature of that, all of the training is typically things that we get after we graduate. So we go through additional extensive training to learn the details of the pelvis and the pelvic floor, as well as kind of the more day-to-day functions of the body. And then I think the other piece is that it's a much more systematic approach. So it's less about strength and range of motion and more about how all of the systems are working together to get gals to be able to not leak or urinate or not be constipated.
Well, that's one of the things I find really interesting because Britt and I have, if you haven't listened to episodes before, Britt and I have some background in pelvic health as well as personal trainers. And what I find super interesting is that people don't understand how much the pelvis and how much the pelvic floor connects with everything else. Like it's just fascinating. So what are some misconceptions about pelvic therapy?
I think probably the most common one is just that pelvic floor physical therapy is Kegels.
Yes.
And it is so much more than that.
Yeah.
It is, I think, more about what is happening at the pelvic floor muscles from a neurological perspective. And are things being inhibited or facilitated because of the alignment of the bones, the position of the organs, stress, tension, posture, hobbies? Why may those pelvic floor muscles not be showing up the way that you think they are?
Right.
And rarely is it going to be answered and solved with just Kegels.
Yeah.
And we're
for
going to have
sure.
a full episode dedicated to that topic
Yeah.
specifically, which I think is going to be really fun and interesting
Very.
for a lot of people. Yeah. But I do have a question about, I think when people think of pelvic floor therapy, they're thinking of the childbearing years. But you also support women outside of that. So we are going to spend a lot of this episode talking about pregnancy and postpartum. But what do you help with outside of that season of life?
So I see younger gals with pelvic pain in the abdomen area and low back. Oftentimes that is with different well-known diagnoses like endometriosis and PCOS. And so kind of from that teenage, late teens, and then from there going more into the season of fertility. So even preconception, helping support the body, the nervous system, the pelvis. And then kind of post-childbearing years, I see women for prolapse, symptoms of pelvic heaviness, voiding dysfunctions, whether it's bowel or bladder. And we'll often see gals later in life where they're experiencing different pelvic pain conditions as well. That can be due to the difference in the hormones and giving them alternatives to keep those muscles and tissues healthy.
Yeah.
Yeah.
So it's not just for pregnancy and not just for just freshly postpartum. It's for before, after, in between, everywhere.
Well, and I like how you said it, when people think of pelvic floor PT, they probably think a lot of like, oh, I'm leaking, my pelvic floor is weak, and we're going to dive into that later. But I like how you mentioned like low back pain,
Yeah.
abdomen pain, like probably SI joint pain, right? Like our torso, our pelvis region is like actually pretty large. And so it's awesome that you extend beyond just the pelvic floor.
Well, and it's like we said, it's all connected. Right.
Yeah. So I think I want to start high level when it comes to pregnancy and postpartum with, can you kind of explain what actually happens to a woman's body during pregnancy? Like what happens with her organs and how do things shift and change that end up affecting the pelvic region?
Yeah. So I think if we look at just the idea that the body is changing in every way, shape, and form to support the developing life inside. So that means that there are going to be shifts in blood flow, lymphatic flow, digestion, nutrient delivery, from a more cellular, basic physiological level. Then it extends to, biomechanically. And as baby or babies are growing, that's going to change mom's center of mass, depending upon how she's carrying. That's going to impact the position of her organs. As baby grows, the stomach and the liver kind of get shoved up and out of the way, and the diaphragm changes, which then is going to change mom's breathing. And so those strategies change as far as how she's then going to be using her core and her abdominal muscles and pelvic floor. And then I think the other piece of that is because it's a chain and biomechanically they're accommodating this growing belly, then also we see shoulder, head, neck posture change just because we have to, otherwise we'll tip over. So, it's far reaching, from up to the head and headaches all the way down to then the feet. You can see foot changes and the ligaments change to allow the body to change, which is every tissue in the body.
Well, then if you take it to the next step, when baby is born, and this is where Drea and I love having conversations with you because we have a lot of background in this, but we know that everything that's changing and shifting now inhibits new habits or creates new habits. And so when baby is born, does everything just go back into place where it started?
Everything's the same, right? Before.
Almost never.
Yeah.
Yeah. Right. Yeah. Things don't recoil because we take on new shapes because we're sitting more. We're now carrying a little life on the outside. We're looking down at them. We're trying to get a heavy car seat into the car. Our day-to-day movements and activities are completely different, and we haven't had a pause or a rest to, necessarily rehab or get our body to be in a position to better tolerate those new demands. So it's kind of working against a quick, easy recovery.
Well, and I guess even if a woman had a pause and a rest, let's just say she had somehow some magical month where life paused for everyone else except for her, and she was able to just take time, would her body naturally restore itself? Because I know some muscles turn off during pregnancy, and you have to actually work to start to get those to fire back up and have that mind-body connection. So even if she had adequate time for herself without understanding a deeper level of education on this and or seeking someone like you, would a body go back to how it should and, started?
I think it does the best it can, but I don't believe that it can fully rebound back to a state that, especially pre-baby, it was at. It's forever changed. And I think also that it can definitely be facilitated and supported and helped to recover better, faster. When you do see someone who has additional training to support the body.
I think a lot in our society right now, well, first of all, after you have a baby, you kind of put your own health at the bottom of the totem pole, right? And it's hard enough just to keep another kiddo alive and get enough sleep. So to think about bringing something else into your schedule, like pelvic health PT, is going to be maybe something mentally that they have to overcome. Would you agree with that?
Yeah. I think, that's one thing that I try to do that's a little bit different is the activities that I have moms trying to work on during the day. I want them to weave into their new life. I want them to find ways to do different breath work or pelvic floor connection coordination training, while they're feeding, while they're holding their baby, and having it on their radar of, or when I'm at the counter doing dishes or washing bottles, what can I do there that's going to be helpful versus harmful? Whereas, I think that having a big, long checklist of things you need to do can get overwhelming, and then moms will shut down, and that list goes to the bottom of the other lists.
Right.
And then it doesn't happen.
So I love how you really focus on that body awareness, right? You help these moms really come to understand how their bodies have changed and then what they can do to support them from here on out. So what do you see as common setbacks for women who might wait for pelvic floor PT?
Or might not even attend at all because they don't think that they have a problem.
Yeah. I think it is never too late to start working on things, and the body is so moldable and adaptable and willing to change with the right inputs. But I think the longer that you wait, the tissues can become stiff. And with the hobbies and the habits and all of that, there's both the literal stiffness of the tissues when they become shortened, as well as just that motor programming, right? With repetitions, our bodies get used to doing the same thing over and over. And the longer a habit is in place, the harder it is to rewire. So I think it just translates to more energy that you have to put into the healing the longer that you wait.
Do you feel like every woman should have at least one appointment with a pelvic health PT after they have a baby?
And is one appointment enough?
So I think every woman should have one appointment before and after. I think that the value in developing the body awareness and the coordination and just becoming attuned to the own sensations in their body, connecting with the baby in their body and having a little, emotional and physical conversation with them prior to birth has tremendous value. And then postpartum, I think, the knowledge that they may receive at one single visit can be life-changing, but then also some of the different techniques that I've learned over the years can literally make measurable changes in one single visit.
Yeah, that's amazing.
And with your practice specifically, you have, people can come to you and you have a space that they can come to, but you also come to their homes. Is that right? Yeah, which I feel like is a game changer for women, especially freshly postpartum, when you just don't want to leave your house and you just feel like a hot mess, right? But I do want to talk a little bit about your method, because I feel like it's a little bit different than what you would see in a lot of other PTs. So you have this connect, breathe, move method. Can you share a little bit about that?
Yeah. So the connect, breathe, move really, starts with that connection phase. So I think that a lot of times gals that come to see me are either symptomatic or overwhelmed with what they're experiencing. And as a protective strategy, they're just up in their heads, they're overanalyzing, they're overthinking. And so that connect part is really helping gals get back into their body to notice the sensations, notice the symptoms, and change their relationship with them and kind of take on that mindset of, okay, these symptoms are here to help guide me to change something. And that they are not there as a form of punishment, and that they're not a victim to them, but rather just changing that to more of a friendly gratitude towards the symptoms of, okay, thanks, I got to change this. Now I notice this. It's not good. It's not bad. It just is. And then the next piece of that is the breathe. So I find that the breath is just kind of a magical entry point into establishing that relationship and that friendship with the body, because the breath is self-contained and it's always going to be self-limited for survival. So you can't overdo things. You can only inhale so far in your container, in your rib cage and your lungs. You can't overdo it. And so I think that offers a nice, safe way to create movement. And in that safety, also, we see nervous systems calm down and regulate. And so we use that breath both from like a parasympathetic or a nervous system calming and regulating thing, but we also use it to literally create movement. And we can change the shape of a gal's body through different postures. And that then will allow the breath to move into one space more than the other. And I kind of describe that as like stretching from the inside out. And then the last piece is moving. So introducing then, whether it's a movement during the breath or after, to help keep that new space that we've created in the tissues. And then use that when we're looking at what the gals are going to do at home to reinforce the new movement pattern, and then find confidence in a movement that may initially have been difficult or challenging with more success and confidence.
Yeah.
I love how you're able to kind of bring in that like mental aspect of what all these women are going through, and emotional, because it is an emotional roller coaster after you have kids, and just figuring it all out and how those really are connected to your physical state. That's really amazing.
Especially the breath. Like, I don't think people realize how much that can make a difference. It's not just breathing. We breathe all the time, but there's so much more to it. Yeah. Wow.
Now, you had mentioned when you started talking about women that you commonly see that oftentimes they're coming to you because they have symptoms. So what are some common symptoms that you are seeing from women, or if they're listening to this and they may have a couple of little things in their life that they're just wondering are normal or are maybe a reason to see you, what are some things that people should definitely be reaching out to a pelvic health PT about if they're experiencing?
Yeah. So the symptoms that gals are usually a little bit more familiar with are leakage, right? So urinary, bowel, or gas. And I think that even a drop is an indication that there is something that could go better in your body. It's a clue that you might be getting away with just a small amount of leakage, but that there's something dysfunctional happening in the coordination and the movement strategy. So incontinence. The other type of incontinence is urgency. So if when someone gets the urge to urinate or have a bowel movement and they have to find a bathroom with vengeance, and they have to know where all the bathrooms are in the stores, and they're very vigilant with that. That is also a symptom. Having difficulty starting a stream of urine, having a stream that sprays or splits, or having difficulty feeling like they can completely empty, or that they have to push and strain to completely empty, both urinating and defecating or bowel movements. Then the other side of it would be more pain conditions. So just pain with sitting, pain with riding a bike, painful intercourse, painful periods. Those are kind of I would say then less than the pain, but more a different symptom would be like heaviness or just feeling kind of draggy and congested in the pelvis. Oftentimes that's a symptom of something called pelvic organ prolapse. And often that can be present with some of the other incontinence and urge symptoms as well. But it can exist solely as a clue that there may be prolapse present.
Okay.
Yeah.
And then what about, like, what advice would you have for a woman who has maybe seen a therapist in the past, whether they were pelvic specialized or not, but they've sought help for maybe some of those symptoms that you just rattled off and they didn't see changes, or they had an experience that they weren't sure about? What kind of encouragement would you have for them to maybe try again, or what should they look for in a professional?
Yeah, I would say try again. You're not the same person you were when you tried before. So, every passing moment we're changing. And so you may not have been in the right place at the right time to make that progress, but try again. And then I think there is value in trying different providers, right? Like we all have different skills and different gifts that we bring to the equation. And just because you've tried and believe you've failed with someone else doesn't mean you shouldn't try again. And I think even having the lens of a different provider, maybe teaching you the same exact thing, slightly different, can really turn on light bulbs and be the game changer that helps you improve.
And I would say too, like there's nothing wrong with asking for a little interview before, or asking to just chat before and see if you click.
Definitely.
Sometimes you might show up and be like, this is not a great fit, and you don't want that.
Right.
Nobody
especially
wants that.
for, I feel like, this type of therapy, because it just feels very vulnerable, and people can feel really embarrassed if they are having symptoms, and it's just hard to bring up. But when they're willing to take that step and be like, okay, I need to take care of myself so I can jump on trampolines with my kids or go running or doing whatever they feel like they're being held back from, they need to be able to be open and honest with the person that they're working with.
We are really fortunate in the Valley to have a lot of pelvic PT providers, but, I kind of think of it as same tribe, different vibe.
Yeah.
Like you can get very different care from each and every different provider, but it's finding the person that you connect with and that you feel safe with. Because if you're feeling threatened, intimidated, overwhelmed, any of those are going to kind of shut down your capacity to heal. So, it's finding that provider that really, really resonates with you and connects.
Absolutely.
Now, speaking of being in the area, I know that you like to collaborate with other professionals and do some workshops, things like that. If people wanted to find out what workshops you may have going on or just stay connected with you, where would be the best place to find you?
Yeah. So on the events in the Motherhood Alliance page, as well as Facebook. So I have a very small social media presence. So those would probably be the best two, as well as the other providers. I would say mostly they're all also Motherhood Alliance members, but I tend to collaborate with a lot of the different chiropractors and trainers.
Okay. And then what is your website as well?
It is connectedcorept.com.
Awesome. Well, we have 3 more episodes with you, and we're going to be diving into a little bit deeper of topics within some of those. Next up, we're going to be talking about birth healing, which I know you have a specialty in. So we're really excited to dive into that. So make sure that you join us for the next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.